We would like to thank the ASCO Program Committee for selecting our data for presentation at the virtual annual meeting 2020. I'm Dr. Dorigo, Director of the Gynecologic Oncology Service at Stanford University and the Stanford Cancer Institute in Palo Alto, California. It is my honor to present our data on behalf of all the investigator sites who participated in this study. Survivin, one of the most common tumor antigens, is highly expressed in advanced ovarian cancer and therefore a suitable target for cancer immunotherapy. DPX-Survivac is a novel T-cell activating therapy that relies on a unique mechanism of action. DPX-Survivac facilitates the active and sustained uptake of target peptides by antigen-presenting cells at the site of injection. The interaction of T cells with APCs primes strong and sustained T cell responses against survivin. We here report clinical and translational data from the DECIDE-1 clinical trial, a phase 2 study that combines DPX-Survivac T cell therapy with intermittent low-dose oral cyclophosphamide for the treatment of patients with advanced ovarian cancer. The DECIDE-1 trial enrolled 22 recurrent ovarian cancer patients. 12 patients had received 3 or more lines of prior therapy. The majority of patients were considered platinum resistant. Overall, treatment with DPX-Survivac and cyclophosphamide was well tolerated. As shown in Figure 1, the majority of treatment-related adverse events were grade 1 and related to reactions at the DPX-Survivac injection site. Our current translation analysis on longitudinally collected PBMCs and tissue samples demonstrates the unique mechanism of action of DPX-Survivac. Figure 2 shows an increase in survivin-specific CD8-positive T cells in the blood of 87% of the 16 patients evaluable for evaluation. Figure 3 demonstrates a significant increase of CD8-positive T cell infiltration at the tumor site on day 56 of treatment in a representative patient with stable disease. This data confirms the ability of DPX-Survivac to induce robust survivin-specific effector T cell responses in ovarian cancer patients despite multiple lines of prior myelosuppressive therapies. T cell receptor beta sequencing analysis on 5 paired tissue samples, as shown in Figure 4A and B, demonstrates early recruitment of new T cell clones to the tumor site under DPX-Survivac treatment. The on-treatment TCR beta repertoire contains between 61 to 86% new clonotypes. 3 out of 5 patients showed reduced clonality, indicating an increase in intratumoral clone diversity. These findings are suggestive of epitope spreading. Preliminary observations suggest that survivin-specific clones, as found in on-treatment biopsies, are correlated with the clinical benefit. Clinical anti-tumor responses have been observed in patients regardless of platinum sensitivity or prior exposure to PARP inhibition or bevacizumab. The case study in Figure 5 describes a partial response in a platinum-resistant ovarian cancer patient with a duration of response for over 8 months. The second case study in Figure 6 shows a rapid progression with a 44.1% decrease of the 2 target lesions in a patient with platinum-sensitive disease. This patient's response is still ongoing more than 11 months after initiation of treatment. The clinical responses in both patients were correlated with an increase in survivin-specific peripheral T cell responses and increased CD8-positive T cells at the site of the tumor. Overall, 19 of 22 enrolled patients were evaluated for clinical responses. Partial responses on target lesions were demonstrated in 5 out of 19, or 26.3% of patients. The disease control rate on target lesions was 78.9%. 7 subjects have shown clinical benefits for more than 6 months, and 4 are still ongoing after more than 9 months on treatment. In conclusion, we demonstrate that DPX-Survivac can induce strong survivin-specific CD8-positive T cell responses in the majority of patients. The combination of DPX-Survivac and cyclophosphamide shows promising clinical efficacy in patients with recurrent ovarian cancer, including in patients with platinum-resistant disease. I would like to thank all the patients, the investigators, and all clinical trial sites that have contributed to this trial. Thank you for listening to this presentation.